Today we are going to be presenting on malaria. Malaria is caused by protozoan parasites of the genus Plasmodium. There are 5 species that commonly affect humans: Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowlesi. Characteristics of malaria and what causes the disease. Malaria is caused by a group of parasites called Plasmodium, which is neither bacterial or viral. It is eukaryotic, meaning it has a nucleus and membrane-bound organelles. The life cycle of malaria is complex, involving 2 hosts: the mosquito, which is sexual reproduction, and the human, which is asexual reproduction. The transmission of malaria is through the bite of an infected female mosquito. It first infects liver cells, then invades red blood cells. It is asexual in humans and sexual in mosquitoes. It is microscopic and varies by life stage. Some unique characteristics of malaria include Plasmodium can alter surface proteins to invade the immune system. Particularly, P. falciparum has developed resistance to multiple anti-malarial drugs, and P. vivax and P. ovale can form a dormant liver stage that causes relapses weeks to months later.
Malaria is transmitted by a vector, a female mosquito, which is infected by one of the Plasmodium parasites. And when this vector bites a human, it transfers pieces of the parasite into the human's bloodstream, and then this goes throughout the body systemically. Malaria may also be spread by transfusion of blood from infected people or by the use of contaminated needles or syringes. However, the disease cannot be spread human to human without some sort of blood interaction. People with untreated or inadequately treated malaria may spread the infection to a mosquito that bites them. These infected mosquitoes can in turn spread the disease by biting an infected healthy people. Spreading malaria directly from one person to another does not occur, like we said, but stored blood products can remain infectious for 16 days. Anyone can get malaria, but there are certain environmental conditions that promote the spread of the disease. Most cases occur in people living in or traveling to countries where malaria is common, like in tropical or subtropical areas of Asia, Africa, and Central and South America. And that's because mosquitoes, the vector of the disease, thrive in warm, humid environments, and they use the stagnant water in these tropical rainforests as breeding sites. So there's a greater risk of infection in places with a lot of water. It is rare in the United States, although it is more common in places like Florida or New York that have a lot of travelers.
Some basic characteristics of malaria are that it is caused by a mosquito bite, and as said in a previous slide, malaria is caused by a group of parasites called Plasmodium, which is neither bacterial or viral. It is eukaryotic, meaning it has a nucleus and membrane-bound organelles. Some signs and symptoms of malaria are fever, chills, general feeling of discomfort, headache, nausea, vomiting, diarrhea, abdominal pain, muscle and joint pain, fatigue, rapid breathing, rapid heart rate, and cough. There are also things known as malaria attacks. These are cycles of malaria that cause shivering and chills, which then progress to a high fever and sweating and will eventually subside, and your body temperature will eventually return to normal. Symptoms of malaria usually are present within a few weeks of being bitten by a mosquito, but the parasites and symptoms can lie dormant for up to a year.
Malaria is diagnosed through microscopic examination of blood films.
It's the gold standard for laboratory confirmation of malaria parasites. There's also a rapid diagnostic test, which is an alternative way of quickly establishing the diagnosis by detecting malaria-specific antigens in the blood. And to confirm the diagnosis of malaria, your doctor will likely review your medical history, recent travel, and conduct a physical exam. Malaria is distinguished by its ability to stand apart from many other diseases, primarily due to its unique life cycle involving two hosts, the human and Anopheles mosquitoes, and the complex interactions of the Plasmodium parasite with human red blood cells and the liver. Malaria is extremely serious and a potentially life-threatening disease. Malaria is a treatable disease, and the type of anti-malarial medication depends on the type of malaria. For uncomplicated malaria, the primary treatment is artemisinin-based combination therapy, which is called ACT. And the primary treatment for severe malaria is parenteral artesunate, followed by a complete course of an oral ACT. Common side effects of anti-malarial medications can include GI issues such as nausea, vomiting, diarrhea, and abdominal pain, headache, insomnia, muscle or joint pain, fatigue, and itching. There is significant ongoing research focused on developing new and improved treatment options for malaria. This research is driven by the need to combat drug resistance, improve the efficacy of existing treatments, and develop new drugs with novel mechanisms of action. Something unique about malaria that a lot of people may not know is that as malaria worsens, it can cause jaundice and anemia, and then if it's left untreated, it can also cause a coma, organ failure, and death. Malaria is also one of the oldest diseases with evidence of existing back to ancient Egypt around 3200 BC, and malaria is the third largest killer of children between the ages of 1 month old and 5 years old.